Have you been injured, had some type of spine exam, maybe even some imaging, and told everything looks normal? Do you still hurt and not know why? Don't worry, you're not alone. A frequently missed injury in the spine is a ligament injury, and this is part 4 of a 4-part series. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and fellowship trained in primary spine care. In addition to my education, training, and experience, I've been managing patients with ligament injuries in the spine for decades. Now, please remember these videos are not a substitute for professional medical or chiropractic advice, for diagnosis, or for treatment. These videos are for educational and instructional purposes only. Seeing the wrong doctor following a spine injury can result in an incomplete diagnosis, the wrong treatment, persistent pain, and even poor recovery, and sometimes no recovery. In this 4-part series, we have already covered in part 1 what a normal ligament is, what its properties are, and why these ligament injuries are missed. In part 2, we reviewed what ligament damage looks like. It's 3 grades: grade 1, grade 2, and grade 3. In part 3, we reviewed the role of chiropractic treatment and management and patient role of treatment and management in the recovery. Now, in this part 4, we're going to discuss how long recovery takes and some common sense things that can be done to increase recovery. So, recovery. Does everybody make a full recovery? Well, the answer is, unfortunately, it varies. Recovery depends on multiple different variables, and this varies from person to person. Some of the common variables are the location of injury. Some locations repair easier than others. Another variable is how severe is it? What grade is it? A grade 1 injury has a totally different recovery profile than a grade 3 injury. Are there any other surrounding tissues that are injured? So, for example, I'm going to use a model right here. So we've got this right here, these bumps right here, the bumps that you feel in the back of your neck. And this right here, this yellow right here, is a ligament. These are the bones of the low back. This is a sideways view of the bones, and here's a disc. So let's say a traumatic force comes in and tears the ligament right here so that this bone is unstable and then it's moving around. Well, it's totally going to vary in its recovery profile if the disc was injured at the same time that the ligament was. So if you've got this disc damaged along with this, it's going to complicate recovery. Well, this right here shows muscle. If this muscle is damaged along with the ligament, different recovery profile. If the muscle, the ligament, and the disc, all 3 are injured, once again, you can understand it's going to be a totally different recovery profile. So there's not a simple answer. The other thing that factors in is the person's tissue quality. So let's say the tissues are degenerated. Well, degeneration is not automatically painful, but degeneration is a reflection of how brittle the tissues are. So the more brittle they are, the more easily they can be injured with less force, and the longer they can take to recover. Another thing that factors in is a person's chronological age. And this is somewhat intuitive. Somebody who is 80 versus somebody who is 8 is going to have a totally different recovery ability. There's also the other person's other health issues. So somebody can have an underlying health condition not related to the spine, such as, for example, like type 2 diabetes, that can complicate recovery. And then also, the most important one seems to be, in many research studies, what the patient does or does not do. So when we see a patient when they come in for treatment, we see them for, let's just say, an hour a week. But we have 24 hours a day, 7 days a week. What is that patient doing on the outside time? Are they doing their exercises? Are they avoiding activities that provoke that? Are they being too active? Are they being too inactive? So a person's own responsibility, what they do on their end, also has a big role to play in their recovery. Now, when these tissues are damaged, when these tissues are torn, the ligaments, regrettably, the tissues do not repair with original tissue. A ligament that is torn replaces with scar tissue. And it's really a repair process. It's not a healing process. And regrettably, these scar tissues are weaker, stiffer, and less resilient to strain, less resilient to the day-to-day activities. Now, this is not a dismal diagnosis where a person is totally going to have to expect to live a life of pain and restricted activity levels, but just knowing that the tissues don't repair with original tissue is somewhat of a wake-up call, and expectations need to be managed, and then a person's own activity levels and how they do and how they affect their recovery and what they do. Are they sedentary? Are they not sedentary? All those things kind of factor in. Now, the other thing that happens too that is very difficult to measure in a clinical setting is the nerve endings. And we talked about this in one of the earlier videos. Not only are these ligaments straps that hold the bones together, but these ligaments are embedded with nerve endings that communicate strain, stress, pain to the surrounding local tissues in and around the joint and then into the central nervous system. If those ligaments are damaged, so that joint continually, even in spite of the repair process, continues to give off corrupted neurological information, that is also a complicating factor. That's going to totally complicate recovery in the long-term prognosis. Generally speaking, broadly speaking, a grade 1, we've talked about grade 1, 2, 3, a grade 1 injury usually recovers where there is minimal pain or no pain and no limited function. A grade 2 is highly variable. Those joints can sometimes repair and the patient doesn't experience a whole lot of pain, and they occasionally have the joint feel like it's going to give way or kind of buckle because the ligaments were stretched and never returned to the original shape. And typically a grade 3 injury, a really severe one, many of those can go on to have surgery in different joints of the body, not always in the spine, but grade 3 injuries typically have a poorer prognosis than, of course, grade 1. So in the long term, these ligaments will repair. They don't typically work mechanically as straps or neurologically as well as they used to prior to injury. These ligament injuries may require, in many cases, ongoing management. It's whatever works for the patient, and it's different for each one. Sometimes it's periodic pain medication. Sometimes it's periodic chiropractic management. Oftentimes it requires ongoing periodic self-stretching and home exercises. Also might require some sort of lifestyle modification. Patient may need to avoid prolonged positions or prolonged repetitive motions because of the tissue damage that's underneath. They can do a lot of their activities, they just might need to pace themselves. So to wrap up this brief 4-part series, ligament injuries are unfortunately common. It is really common to see the low complexity grade 1 injuries diagnosed. It's very common to see the grade 3 ones, which are somewhat catastrophic, diagnosed. It's the grade 2s, the ones that are in the middle, where the tissues are deformed, the joints are unstable, the patients have recurrent pain, recurrent disability. Many of those are the ones that end up being missed. And unfortunately, in spite of doing everything right, some patients make a full recovery, and unfortunately, some patients do not. So thank you for taking the time to watch this video. You have many different videos to pick from. I'm pleased that you chose this one. If you or somebody you know has a spine injury and either has not made recovery as you would expect or want to avoid making a poor recovery, please give us a call. We'll be more than happy to do an examination, order the appropriate imaging, and come up with an appropriate treatment plan. I wish you all the best in your journey, and until we meet again, be blessed.